All right, it's 7 p.m. I will open the meeting by reading this Zoom opening statement. So in accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting on January 20th, 2021 on the Zoom platform and in accordance with the town's policy directive and guidelines issued back in April 1, 2020. I ask that all Board of Health committee members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. The meeting is being recorded and will be available for later viewing on the town's website. All committee votes will require a roll call to be done, and we'll start with an attendance roll call. And for members of the public, please unmute yourself only when I've opened the meeting to public comment. So Board of Health members, Jill Block, are you present?
You're on mute, Jill.
Yes. Yes. Hi, I'm here.
Great. Mark Haddad.
Present.
Alma Healy.
You're on mute.
Present.
Good. We do not have Ray Considine this evening, but we still have a quorum, and Susan, I see you are there as well, so we can begin. I want to say two things before we start with the agenda. The first is thank you for the date change. I had the late shift last night, and that's very difficult to get out of. The second thing that I just want to mention before we start, and this is pertinent to you, Karen, I learned at the chair's breakfast this morning that at least one other town committee has had an interloper sort of crash their Zoom, spewing racist information and personal information to the Zoom meeting. So I just want, I don't often pay attention to who's joining in on the meeting. Susan, or Karen, if you can just keep an eye on anyone who's calling in and ask them to identify themselves if you see a telephone number pop up without a video. And if that happens, I believe, Karen, you do have the capability of disconnecting that person, correct?
I think so, yeah.
Okay, all right. Well, we will hope for a peaceful Board of Health meeting this evening. All right, so the public hearing is item number 2 on our agenda, and that's a variance on the on-site sewage disposal. Susan, do you want to give the board an update or a summary on this for us?
I do, and then Mark Farrell from the engineering firm is also here. So this is 171 Hawthorne Lane. They're looking for local upgrade approval for a number of variances. The back of the property goes right down into the wetlands, so the septic system has to be in the front yard, and they have very limited space to put it. So the variances that they're asking for are to construct a leach field 5 feet 11, 5 feet 1 to the property line instead of 10 feet as required by Title V. To construct a leaching field 13 feet to the foundation or cellar wall instead of the 20-foot required, and to construct the septic tank 6 feet to the foundation instead of 10 feet as required by Title V, and to allow a sieve analysis instead of a percolation test as required. I think it's all good sandy soil, and they couldn't probably perk it because it's in groundwater. So they will do a sieve analysis to prove that it's the sand that we think that it is. So with that, maybe Mark Farrell would like to give his presentation.
Go ahead.
Hi, good evening. Mark Farrell, Green Hill Engineering. I'm the designer on the project. Basically, all the variances are to be able to squeeze it in between the house and the road there. We had to relocate a water and a gas line to make a little bit more room. They're all local upgrades, and they're all things that the local Board of Health can approve. It's an older system. It's been there since the house was built, so it'll be improvement over what's there. Basically, we'll be putting in a new 1,500-gallon tank, which will flow into a pump chamber, and it will pump the water up, so it's a little bit has more separation to the groundwater. As you mentioned, the back of the land is lower and closer to the water table, and there's a wetland in the back, the rear of the property, so it's really not an option to put it back over there. I'd be glad to answer any questions or comments if the board has any.
Is this likely to be the scenario with the other houses on that street?
Yes, I think some of them have been upgraded over the years.
And
The backyards tend to flood occasionally.
yeah, okay.
They're all kind of, I didn't go all the way down the street. I came from the center of Concord over there, but it is a low-lying area. And under current Title V regulations, it would be a challenge to build there, but I believe all these homes were built many years ago.
I imagine so. Okay.
Is this construction because of a renovation to the house or because the previous one failed?
The gentleman's selling the house, and so he had a Title V inspection done, and it didn't pass the Title V inspection, so he's needing to upgrade the system in order to get compliance with Title V and sell his home.
And Jill, it's important to note that any future buyer, because this is being upgraded under local upgrade approval, will never be able to add bedrooms, which would make the system even more non-conforming. So I believe it's a 4-bedroom design, and the house will always have to stay a 4-bedroom design.
Okay. Any other questions from board members? And Susan, what was the recommendation from the Board of the Public Health Department?
We recommend approval because I think this design is the best we can do on this lot to upgrade an existing system. As Mr. Farrell said, you probably couldn't build houses there now if it were brand new construction, but these are existing houses and it is what it is.
Yep, exactly. All right. Any further discussion?
The existing septic, is that in the front yard currently?
Yes, the current system is in the front yard, and they would have to dig out the old system and then rebuild it in the same area.
So, I mean, even when they built the house years ago, they knew that the high ground was in the front of the house, and that's where they put the existing system.
Yeah. Yeah, I think, I'm not sure we have much choice here, so I think it's a reasonable thing to move forward with. Without any further discussion, does someone want to put forward a motion to approve?
I'll move to approve the variance as discussed.
Thank you, Mark. Do we have a second?
I second it.
Great. So let's vote. I will vote yes. Alma, how do you vote?
Yes.
Jill
Yes.
and Mark.
Approved.
Okay, the motion passes. All right. Thank you, Mr. Farrell.
Thank you very much. You guys have a wonderful evening.
Thank
You
you.
as well. Dr. Green,
Yes.
we do have someone on that joined the meeting that doesn't have their name identified. Did you want me to
Yes.
ask? Whoever's on the meeting that's TMBG, would it be possible for you to provide us your name?
They're muted.
Hmm. It's not letting me unmute.
Yes, what was the question?
We were wondering if you could identify yourself with your name.
I'm Tanya Galis, but I don't think I have to, members of the public do not have to identify themselves, but I'm Tanya Galis.
Thank you.
Yep.
Appreciated.
Yep.
Okay, item number 3 on the agenda, we will move forward. Concord resident Stuart Sinclair Weeks asked for an opportunity to discuss his concerns relative to orders and advisories pertaining to face coverings and restrictions on family visitations. Mr. Sinclair Weeks, you have the floor.
Thank you very much. I'm very grateful to have some time. I'm here on behalf of Can you hear me?
Yes.
Do people hear me? Can anybody hear me?
Yes.
Yes.
Okay. Okay. So I'm here on behalf of my father, who's in his 98th year and on his deathbed, and who keeps asking me to come to be with him repeatedly. And what prompted me to actually try to get on the agenda, and thank you for allowing me to do so, was that I found myself in the Christmas time not responding to his calls because I didn't want to continually disappoint him. And as I became aware that I'm not responding to his calls for that reason, I realized that doesn't suffice. That doesn't suffice. My father said, always get all the facts. There's always at least two sides every story. Make sure you have the whole picture. Friends, I don't think we have all the facts by any means. 25 hours a day, it's being drummed into us, this fear mongering with the pandemic. And that's my concern. And I address you as fellow Concordians. So I have some more comments, but before I want to ask if there's any response to what I emailed, if you all received it, which raises fundamental questions about the regulations, the rules and regulations I'm bringing forward. So that's how I'd like to start. If there are any comments at all to what was sent.
I don't think this is the time or place to sort of have a discussion regarding, the facts about mask wearing or visitation, or that this isn't the place. Did you have a question or a request of the board?
Thank you, Deborah. So I'll proceed with my comments and they're not long. So my name is Stuart Sinclair Weeks. I'm a native son of Concord. I grew up in Concord. I'm the founder of the Center for American Studies. We're in our 45th year. And as I mentioned, I'm here on behalf of my father. I grew up hearing to whom much is given, much is expected. Many are called, few are chosen, and fewer still make the choice. I think we in Concord have been given much. I wanted first to thank you for your volunteer service. I'm aware that that is what it is. It requires a lot of time and effort on top of otherwise busy and often hectic lives in these times in which we live. And I want to apologize as well for bringing a concern that is disconcerting, if not concerning. And that is what is going on. What is going on? We have more people who will die of cigarette smoking, of alcohol this year than what's projected for the pandemic. We don't shut down those outlets, cigarette outlets, alcohol outlets. So I'm wondering really what's behind this. I spoke this morning with Sheriff Mack, who's the head of the Constitutional Sheriff's Association, and he took a case to the Supreme Court, which concluded with Justice Scalia saying the federal and the state government cannot interfere. This was a Supreme Court decision that was decided on behalf of of Sheriff Mack. He sued the Clinton administration, and he won. And the decision was, and I can get you this information, that the federal and state government can't interfere and influence local officials. Yet that's, from what I can tell, exactly what's happening. The mandate from the governor, the advisory from the governor is, as we all know, not from the governor, it's from the CDC. And the former number 4, Dr. Thompson, CDC, said in effect, friends, the CDC, truth be told, is a subsidiary of Big Pharma. The same Big Pharma that's being sued by our attorney generals on our behalf has been or is in every single state in the nation. So I'm looking, Deborah, at you. You've had a long day. You don't seem tickled by what I'm saying. This is a dilemma I have, is can we even have these conversations? If not with the health board, since it's a health-related matter, where does one go? Or do we just shut up? How does one bring these considerations forward? My father, as I said, says repeatedly, why don't you come? I want to see you. Come and take care of me. And I'm sure I'm not the only one. Do we just say, sorry, Dad, that's just the way it is. Tough luck. Die alone. We'll wave to you over Zoom. Die alone. Friends, when the American Revolution was over, which began, as we know, with the shot heard around the world in Concord, the General Court sent a copy of a constitution to Concord and the other towns and said, sign on the dotted line. Many of the towns did that. Our Concord forebears did not. They said, no, we haven't fought a revolution against a centralized power in London to replace it with one in Boston. We're going to call for a constitutional convention in order to establish a government of, by, and for the people. Again, our forebears said no to the General Court, as they said no to England, to whom much is given, much is expected. That constitutional convention was the first constitutional convention in the nation, in our history, that our forebears established. So, am I understanding, Deborah, that this is an issue that you don't find it's appropriate, if I may ask, that the health board take up? If so, what would you advise me to do?
First of all, sir, I can offer my deepest empathy for your situation with your father. I have seen since March countless times where family members are separated from their loved ones. I have held the hands of people dying alone, and those moments will haunt me forever. I think this is an incredible tragedy. I think everyone here in this meeting tonight probably has family members that they have not seen, family members that they may have lost, friends that they may have lost that they wish they could have spent time with. So you have my utmost sympathy. This is a terrible situation, and this has been a terrible year. And, you know, I can understand your frustration about the visitations and the masks. It seems that this mask wearing has really produced a feud between public health and civil liberties. But I would take us back 50, 70 years to when seatbelts first came out. And people did not want to wear those seatbelts because they argued the decision was personal and not a legal one. The same thing held for tobacco, which you referenced. People felt that they still had the personal liberty to smoke despite decades and decades and decades of research that demonstrated tobacco is bad. So I would I would argue with you that mask wearing has saved a life. Certainly the fact that I am still able to see patients this far into the pandemic is probably because I've been able to wear a mask and take care of patients. So I'm really not willing to debate that here. And it is visitation with your father in his facility is not something that this board is willing to overstep the Massachusetts Department of Public Health. I will fall upon their guidance. I think Newburyport has done a really good job keeping their residents very safe. I understand the loneliness of it. I understand the tragedy of it, but I do not think that the role of the Board of Health of Concord is to overstep those bounds.
Deborah, I hear you and I appreciate your words. I hear the letter and I think I pick up the spirit of your words. So what advice, friends? I'm a Concordian. I'm speaking to fellow Concordians. How to best do justice, not just to my concern, but to my father's concern in this circumstances. What advice would you offer me?
Well, I know many facilities are allowing people who have entered the end of life phase, hospice, to have family visit. And so I apologize, I'm not aware of what the policies are at Newburyport, but I know many facilities are allowing family members to visit in their final days. So I would encourage you to contact them and see where you get.
Okay. Well, I'll end up with just a last comment and thank you, Deborah. I hear you. I've been pursuing that, but it hasn't been as successful as I had hoped. And again, I speak as a Concordian to fellow Concordians. What I found in my work over the years, which has included welcoming over 500 international leaders from 68 nations who said to me as I looked into my eyes, are you aware of the significance of your town's heritage for the rest of the world? These are people even from Trinidad, Tobago, who one would wonder if they knew much of Concord's, America's history. But I found in my work that there are at least two kinds of people in positions of leadership. There are those who are there to perpetuate the status quo. And the status quo is our foundation, so it's not insignificant. I'm not dismissing it. And then there are those that are there to help bring forward the new. It was only 30% of the colonists who actually fought the revolution to bring forward the new, so it wasn't a majority. So I'd like to leave my email address, and if there's any people on this health board who can relate to what I've just said, and who are in the positions of influence that you have, thanks to giving your volunteer time, who can hear what's speaking through my words and behind my words. But there are also those in positions of influence and authority who are there to bring forward the new. I'd be grateful to hear from you. I will follow up, Deborah, further on your advice. My email address is Stuart, STUART, B as in boy, Weeks, WEEKS, @gmail.com. And I will send a note to one and all with appreciation and some reflections on this meeting. Thank you very much again for taking the time. Thank you for all your volunteer efforts in these challenging days. I appreciate it.
Thank you. Okay.
I'll bid you adieu. Thank you.
Thank you. Good evening. So we can move into agenda item 4, if that's okay with everyone. A discussion of COVID-19. Susan, I'm really thrilled. We've vaccinated first responders, so give us some good news.
Unmute yourself, Susan.
There we go. Sorry. So we had the clinic this past Thursday, Friday, Saturday. We vaccinated 420 people. We did it in partnership with 5 other towns: Carlisle, Bedford, Lincoln, Maynard, and Sudbury. We got all of their fire, police, and EMS vaccinated. We got the school nurses from all the towns vaccinated. We got many of the COA directors and social work staff vaccinated, and the Bedford and Sudbury MRC and CERT teams who will be working in those towns' clinics going forward. Those folks got vaccinated. So
Great.
it really was our trial run with, we set up the new structure, the 33 by 33 temporary structure in the parking lot at the high school. And so it was our trial run to see if we could make it work. And, we had a few little hiccups, but we worked them through, and we've got some ideas for how to make it even more efficient for next time. So I feel like it was a success, and I feel good about it. And the vaccine is coming. The screenshot that Karen can't share is sort of, you've all seen like the phased approach. And
Yeah.
DPH announced today that we are now at the end of, we're entering the end of phase 1, where home-based healthcare workers and non-COVID facing healthcare workers can now receive vaccine. So that will be happening as of tomorrow, which is great. This is sort of the phasing timeline. So I can't show this to you and look at it at the same time, and it's backwards for you anyway, but we're ahead of what this, they had sort of, DPH had sort of thought that we would get to the end of phase 1 in early February. So we're actually a week early maybe, and that's good. And then DPH is also posting this map that shows where people can get vaccine. The purples are the pharmacies that are going to be offering it, and there's other mass vaccination sites. So anybody who's eligible can go to the map and find a site to be vaccinated, which is great. And that map is getting populated day by day.
So will people have to make an appointment though, or how is that working?
Yeah, but there's live links to all the sites where you can make appointments.
Great. Good.
So it's great. So in terms of where we're going now, it's looking like we're going to do a second dose clinic for the first responders on February 12th and 13th. Once DPH opens up the first step of phase 2, that'll be residents age 75 and over. And we're hoping to hold multiple clinics the week of February 22 to 26th, which is school vacation week, which is good. Because use of the site right now is restricted to after school hours and weekends. And if we can do it February vacation week, we can do it in daylight hours during the week, which will be better for older residents. And I think we're planning it as a drive-through for those older residents rather than having them get out of their cars and go into the building.
Wait a
So
minute, I
that's
don't
the-
think February school vacation is, wait, what week did you say?
The 22nd to 26th, it's not.
Probably like the week before, like,
I think it's the week before.
It's the week before.
Uh-oh, okay. Well, we might have to rethink that then.
Yeah, but no one's at the high school on Wednesdays, correct?
I don't know. I'd have to talk to
they
Lori
are.
Hunter about that.
They are, it alternates.
Okay.
There's kids at the school on Wednesdays?
Yeah, it's
Uh,
half day, but yes, they have in-person Wednesdays, they alternate. Which
Is there a day that no one's at the high school?
No,
No, okay,
the middle school has no one on Wednesdays, but the high school does.
okay, all right.
So we're hoping to be able to do the age 75 and up soon. And the other point I wanted to make is that Emerson Hospital and the partners affiliated hospitals have announced that all the physician practices associated with those hospitals will have vaccine for their patients. So, between the private healthcare providers, the pharmacies, and the town, I think that people are going to start to be able to be vaccinated pretty soon.
Good. And how, when we start vaccinating in the clinics, if we have the Moderna vaccine, will we have like an exact match of doses to people we're going to vaccinate? Or like what happens if we have a couple extra doses and no one left to vaccinate? Will we quickly try to call some people, or what would we do? Would we have
Yeah, that's a challenge. So, we order the vaccine from DPH. We don't have any other access to it other than DPH. We tell them how much they want, they ship it frozen, we keep it frozen. We only defrost enough for each day's clinic, you know, and we'll be using a piece of software that allows people to register. But it is challenging because they're 10-dose vials.
Yeah,
And once the vial is punctured, it's got to be used in 6 hours. So if people don't come in even multiples of 10, then we've got to find somebody to give it to. The good thing is Trish can usually take it back to Emerson Home Care, or the hospital will always take it, and maybe we'll try to have a waiting list of folks that are sort of next in line for it.
yeah, that might be a good idea, just to, you know, as a backup, have some people that could, you know, quickly come down.
That's kind of who the school nurses were on this first responder clinic. We sort of had them on alert for Saturday if we had leftover doses,
Good.
because we sure don't want to waste doses.
Nope, not at all.
If I may put in a request, I have my husband who had half his lung removed. He is 80 and would be a prime candidate if you have a spare shot you're trying to get rid of,
Okay, that's great to know.
and he's around.
Okey doke, that's
Yeah.
good.
We'll put it on our big gigantic list. But we will keep you
We'll
in
put you
mind.
at the top, if you'd be kind enough to send me your phone number, Alma,
You bet.
because we'd probably be calling you like, you know, within an hour before a clinic ends, you know?
Absolutely. That'd be great if you can tell me, and that way we'd be very much on alert.
Yep, okay.
Good. Yeah, let's get some high-risk people on that list that we can get down there if we have extra doses, so.
So if anybody knows anybody else, send me their names and phone numbers and emails if you've got them, and I will start the list.
Thank you, Susan.
Great.
Susan, is Tricia the one that's actually administering it? And like, what kind of refrigeration are you using there? How'd that work?
So we're keeping it frozen. The defrosted vaccine is in the refrigerator at the police department, so it's in a secure location. And it's easy enough for her to bop over from the high school to the police department to pick up extra doses. So she'll bring like the first half of the doses over for the beginning of the clinic, and then midway through, somebody goes back and gets the second half of the doses. But I will say, if we're going to gear up to do 2 to 3 clinics a week, I am actively looking to hire nurses and find volunteer nurses. We've probably had 20 people offer to volunteer, but if any of you know nurses that would like to be hired, I think I'm asking for people to make a commitment to work 1 clinic a week. I mean, I can't ask Trish to be the lead nurse at every clinic, so I need to clone Trisha or find maybe 5 other lead nurses who really can run the clinics, and then nurses that can just vaccinate and do medical screening. So if any of you know anybody, any nurses that might be interested in working, I think we're willing to pay them. I mean, we'll have to work that out, but we're definitely looking for people.
All right, I'll get you someone. I got
That
people.
would be great.
And
that would
I'm
be great,
always
Deb.
willing to vaccinate myself, so.
I know you've been kind enough to say that.
It's been a while, but I think I can give a shot.
I imagine you can. Like you don't have enough to do.
I would actually be kind of excited to work the vaccine clinic. I don't know. It's just, I feel like it would just be historic.
It would be a good thing for the Board of Health chair to be.
Yeah, sign me up.
It's kind of inspiring, you know, it's kind of inspiring. Who thought that we would have a vaccine in a year?
No, it's great. I'm really,
Yep.
it's a really good morale boost, so.
Yeah.
It gave
I
me
feel it's good.
goosebumps when I went into the refrigerator and you see this tiny little box, and that's what everybody's all, gave me shivers.
Right. And when you see the police presence, I saw the police outside of Newbury Court the day that they were doing their first round, and it was just incredible how much security there was around it. That was kind of sobering.
It is, it's weird.
Yeah.
Right, Sue? It's weird.
It's a funny feeling, but a good feeling.
Yeah.
That's great.
So I really do think we're turning the corner. I mean, I think we're going to run the clinics probably from February to May by the time we get everybody done, but I still feel good about it.
Good. I did also hear that through CVS, there's about 150 people in Minuteman ARC that got vaccinated as well. So
Yes.
it's
That's
good.
great.
Yeah.
The licensed congregate care settings had contracts with either CVS or Walgreens to get done.
Great.
We still have some congregate living situations in Concord, like Timothy Wheeler House, that I would like to be able to get done, but Tricia doesn't have the time to do them. So if anybody has any great ideas for a nurse we could send out to do that, that would be great.
Okay.
It wouldn't take very long to do them.
So I think there's quite a lot of computer work with this and rescheduling for the second shot, right? So it's not just giving a shot. There's quite a bit of work in between.
Yeah, so of course, anything we do, we have to do again in 28 days.
Yep.
So double the fun. And we're using state has a piece of software called PrepMod, which allows me to schedule clinics and schedule how many appointments we want to have every 15 minutes. So people will have to sign up online for their appointments, and then we'll have to have people with laptops at the clinics checking people in, and then connecting patients with vaccinators, because all the information will flow directly into the state's MIIS, which is their immunization database, so that we know who got what shot, which is particularly important for a brand new vaccine. In case we have adverse events, we really need the database of who's been vaccinated and when and with which vaccine.
Yeah.
Right.
Right.
Patty's
Looks like
trying to say something.
Patty. You gotta unmute yourself.
You're on mute,
muted.
Patty.
Patty, unmute. I can't unmute you for some reason. There you go.
I got it. Deb, is it the wrong time to say something? I represent the COA board.
No, you're welcome to speak.
Well, I'm just wondering if the COA, I don't know if this is something they'd be open to or what, but if they had a list of names of people 75 and over who would possibly be available on a last minute notice, is that something that I could offer to them?
It seems reasonable to me. So, yeah, if we could get a list of people and go forward. I think as the month of February as we get into the month of February, what I'm going to expect is that people will start to get their vaccines from their primary care doctors, and they'll have sort of multiple possibilities, but the quicker the better. So
Just to give you an update, my primary care said she wouldn't be getting any vaccines at all until May for anyone.
well, you should get an Emerson primary care doctor.
She is part of Emerson, but she's with Lincoln Physicians. I don't know if they're different or what, but she's
No,
part of.
you can get vaccinated through the hospital. So the hospital will be vaccinating patients that have an Emerson affiliated primary care physician. So yeah.
Should these people call Emerson?
No, there's information on the website, but they're not taking appointments yet. So they'll check the website and they'll let people know when they can schedule.
So may I pass this word on to Ginger, the director of COA, that a list could be started for people 75 and over who might be able to go in for last minute injections needed if you didn't want to throw them out.
So I'm fine with that. I think that's a good idea, but so the next clinic we're going to do is the first responder second dose clinic on the February 12th and 13th. Because all of those people will be coming back and we've actually administered 420 doses, I don't think we're going to have a lot of leftover doses from that clinic, but if we had a short list, that would be fine. And then the
Okay.
next clinic will be for everybody 75 and over. So that's where we are.
Okay, and who would that be sent to?
You should send it to me.
Okay, thank you, Susan.
Yep.
Okay. Anything else on COVID, Susan?
No, I think that's kind of where we are today.
Okay. It sounds like the schools are interested in pursuing the pool testing. Is that what I'm hearing? Have you heard about that?
I think they are. I really haven't talked too much about it with Laurie Hunter because it doesn't really involve me.
Okay.
So I can't report on that, but I can get in touch with her and let you know what she says.
No, I was just curious. I mean, it sounds like the school has, the capability to test symptomatic people and even get, asymptomatic people tested with the Broad Institute. So, I think as we're hearing about more and more asymptomatic people being the transmitters, I think the more testing, the better. So it would be something that I would support.
Yep,
If
absolutely.
they don't
And
need our
it's
approval, that's fine.
It's been really great. Tom Judge helped the school set that testing thing up so that kids that are symptomatic can be tested as quickly as possible and get results as quickly as possible, which has been huge.
Yeah. Yeah.
Really good thing. And the
Yeah.
other good news in the school is even though we're having lots of cases, we're not seeing any community transmission in the school. There's still isolated cases, which is great.
Yeah. No, I think we're doing really well. Really
Yeah,
are.
I didn't think we'd get this far.
Me neither. Not at all. All right. Any further discussion, or should we go on to calendar and minutes?
Deb, I'm just curious to hear what's going on in the hospital, whether you've seen any change in cases and chaos.
The hospital is still, this hospital's busy. I think it's a very fine line to keep the hospital open for surgeries and, sort of routine care, but also have room for COVID patients. And but I think that they're maintaining that tightrope well. I think, let's see, last night or the night before, I think there were probably 19 COVID positive patients and a handful of others that were patients under investigation that were hospitalized. So I feel like it's a little bit of a different population I'm seeing now. I think whereas in March and April, we were seeing sort of the nursing home kind of population. Now I think it's more the younger people, sort of my age, 50, 60, who are getting it and, maybe have some risk factors and aren't doing so well. So that's kind of the type of patient that I'm seeing now. So and then I think in general, we're just seeing more people come in who have symptoms of COVID. I think back in the beginning of the pandemic, those people were really staying home and just kind of riding it out. But now people know there are treatments for this and successful treatments. So I think more people are coming to the hospital just to see sort of how sick they are and do they qualify for remdesivir and steroids and things like that. So there has been a little bit of a shift in that. But I think, the hospital's doing okay. So knock on wood.
Good. Thank you.
All right. Board minutes. I think Mark probably had some edits for Karen to the minutes of the November 17th meeting.
Many.
Anyone else have edits for Karen?
No.
No.
Do I have a motion to approve the November 17th minutes?
I move to approve the November 17th minutes with modifications submitted by Mark.
Thank you, Jill. Do I have a second? All right. So I vote to approve the November 17th minutes as amended. Alma, how do you vote?
I vote to approve the minutes as
Yeah.
amended.
Jill?
Approve.
Mark?
Approve.
All right. Thank you. The minutes are approved. Any concerns about the dates of the meetings this year?
Not as yet.
No grand vacation plans for people? No. Sadly.
Sadly.
Yeah.
All right. And then board member reports. The only thing I will say from the chair's breakfast this morning is that the town meeting is scheduled for June 13th. It will likely be the same format, outdoor, spaced out town meeting. at the high school, similar to last fall, unless things dramatically improve in the state. I did not expect the Board of Health would have any warrant articles to put forward at the town meeting. I think we've got enough on our hands right now, so that's all I have. Anyone else? No?
No.
All right, staff reports.
I think I've said everything I need to say.
Okay. I saw you sent out the latest tobacco report in December, I think. So it sounds like rounding is going well.
Yep, I think so.
Good. Okay. All right. I don't have anything else. Anyone else?
This woman, Tanya, wanted.
May I ask a question about a COVID-related question?
Of
Yeah,
course.
Tanya Gailus, Gailus, 62
Mhm.
Prescott Road. Thank you. I have a concern about the BD Center. I use their facilities. I know they take great care to make it as safe as possible for everyone, and I know it's helpful for me to go and work out and swim. I have a concern about people who are using the pool when they are in water, whether it's children or adults, speaking to each other, sometimes in a loud voice. Because now that we know the virus is airborne, it sort of makes me a little concerned. They make sure that people are wearing masks on the deck and everything, even walking a very short distance. But when there are people just speaking to each other just because they happen to be in the water, and sometimes loudly, it makes me wonder. And I did speak with Mr. Dutton about it. You know, he was very gracious and everything, but I don't think it sounded like he could do anything about it. But I just wanted to know what your opinion might be on that particular kind of behavior.
It's not something I've thought of. Susan, do you have any thoughts?
I think it's difficult to police those things.
I would agree.
Well, actually, this is not about policing. They for that matter, the lifeguards do police people. I mean, even if you're walking from just like 10 feet from the shower, from the pool to the shower, they come and tell you to put your mask on. I'm more wondering if there could be a sign or something that said, you know, don't speak without a mask on if you're in water or out, something like that. I mean, policing is the next level, but this is more about having a policy in the first place.
Well,
Whether
we can't make people wear masks when they're in the water. That's specifically, they're allowed to be unmasked in the water, so.
But can they be asked not to speak and yell? I mean, I'm just worried because of the virus being airborne. That's all. You know, that's otherwise, because the rules were all set when the understanding was that it was not airborne. It just traveled in water particles or something. And the 6 feet distancing, etc. That's all based on that. But if it's airborne, it's a very different matter, right? I mean, am I?
I understand. I think it's frustrating because a lot of the information and the transmission and everything has changed so much over the past year. I think it's challenging to sort of know what's right. I think unfortunately in many of these situations we have to place faith in our fellow townspeople, that they are not going out and swimming and exercising when they're not feeling 100%. And so I think, I'm really not inclined to make any kind of regulation on the BD Center that people cannot speak or shout. I think that's taking it a bit too far, to be honest with you.
Okay.
But I can understand. It's concerning. It's hard to go to the supermarket even, you know?
Yeah, but
I
I
get it.
mean, this is indoors. I mean, it's much safer when somebody's walking on the deck without a mask on a short distance than if they are asymptomatic and they're in the pool and just shouting at each other.
Yeah.
That seems,
So stay 6 feet away from them. I think that's the
Well,
best advice I can give you.
well, that they
Yeah.
take care of that part. Yeah.
Yeah. Good. So then you should be fine. All right. Anyone else? Board members?
I think we have another person raising their hand.
Great.
Dr. Green, this is Carlin Reed, 83 Wits End. Just want to compliment you folks on the fine job that you're doing. Keep it up. Well done.
Well, the compliment goes to Susan Rask and her team in the public health department. I mean, we are so fortunate to have them. And Trisha McGee, our public health nurse, works 24/7. So we are really, really lucky in this town. I can't even tell you how lucky we are.
Thank you, guys. That's nice of you to say that, Deb. We are working hard. We're trying hard.
Yep.
You bet.
No doubt.
All right, ladies and gentlemen, it's approaching 8 o'clock. So without further ado, do I have a motion to adjourn this evening's Board of Health meeting?
I make a motion to adjourn it.
All right,
Second.
I have a second. Great. I vote in favor of saying goodnight and adjourning this meeting. Alma, how do you vote?
I agree with adjourning the meeting.
Jill, how do you vote?
I agree, and I say goodnight and thank you to you all.
All right. Mark, how do you vote?
Approved. Good night. Thank you, everybody.
Great. Good night. Good night, Susan. Good night, Karen. Good night, everyone. Thank you very much. It's a pleasure.
Thank you, guys. Nice to see you.
Always.
Bye-bye.
Bye-bye. Thank you.